Collaborative Academic Practice Fellowship Program, or the CAP Fellowship, is a unique opportunity for point-of-care health professionals at UHN to take on quality improvement initiatives that address important practice gaps in their practice areas. So the beauty of the CAP Fellowship Program is that it really leverages the knowledge of those working at the point of care who know best where the gaps are and how they can best be addressed to improve patient care. Participants in the CAP Fellowship Program receive paid protected time over a 6-month period to complete their project work and also attend weekly seminars on a range of topics including leadership, change management, and quality improvement, all the essential elements for leading a successful change initiative.
So our fellowship project was titled Caring with Courage, an interprofessional approach to improving palliative care in the emergency department at Toronto Western Hospital. I had the privilege of co-leading this project with Rebecca Bliss, our social worker in the emergency department, and together we were able to identify gaps in our practice from our own experiences. We knew that palliative care pathways and algorithms were not effective in our department. We have created tools and resources for frontline staff in the emergency department, and also included some education material for orientation sessions that assist our advanced nurse practice educators during orientations. And now we do have established roles for interprofessional care team members of more than just nursing and social work, but including respiratory therapy, physiotherapy, spiritual care, and other members of our team at Toronto Western.
So my CAP Fellowship project was to develop a return to work planning template for cancer survivors to facilitate their transition back into the workforce once they're done cancer treatment. So the purpose of the tool is for them to be able to document all their return to work needs in one spot, and then together with the healthcare provider they can brainstorm what types of accommodations would be helpful for them when they're going back to work, and then they can use that tool with their employers in having a discussion around what supports would be helpful for them as they transition back into the workforce. I think for me the biggest impact of the CAP Fellowship was just being able to identify a gap in clinical practice and then having that protected time to be able to kickstart a project and get some buy-in from my colleagues and my managers and my directors. And really as a result of this buy-in, I've been able to advocate for the launch of a new return to work consult. So now, in addition to just having the return to work planning template that we were using as part of our standard of care, we have an entire program that's dedicated to supporting patients returning to work after cancer treatment. I think as a clinician at UHN, we're not always necessarily incentivized to engage in quality improvement projects or research projects. And I think that a lot of clinicians have great ideas because they are the ones who are touching the problems and living through the problems every day.
The Participatory Learning and Research Program is a program geared for frontline staff. It's to help them become more engaged in research, but also to guide them and provide them some assistance in conducting their own study within their clinical practice. The unique thing about it is that it provides a mentor for you. So each study team has a research mentor who either has expertise in the research methodology that the team is using, or perhaps they just have expertise in the topic that you're doing your study on. What we found is that despite giving patients education preoperatively and giving them a booklet, they were calling pretty consistently with a lot of questions that were mainly in regards to what should they expect before surgery, what should they expect while they're in hospital, and then what should they expect once they go home in the community. So we thought that in order to be able to help these patients with this issue, maybe we should really look in a bit deeper at what their experience is like, what is the conflicting, confusing information, and perhaps we can use that and apply it in our education and improve our patient education materials by addressing those things from the outset, by perhaps changing the way we deliver our education. Maybe there's ways we can, based on their feedback, change the way we deliver the care on the floor. What we found most useful was having that expert mentor, somebody that we could go to on an informal basis and meet with that we had to answer some questions that we had along the way. So the impact that I think our study will have is that it will help patients feel a bit more educated and prepared when they're coming in for the surgery, as well as I think it will provide some guidance for our community partners and allow for more consistent care once they go home.
So UHN's Collaborative Academic Practice and Toronto Rehab's Research Nursing Internship provides nurses with an opportunity to be seconded for 6 months in order to spend time with the nursing research scientists. So the goal is to inspire and build capacity for future nursing researchers and networking with acute care centers in order to facilitate the knowledge translation and that dissemination of knowledge.
The CAP internship is a great educational phenomena and partnership. Nurse scientists could definitely contribute to next generations of nursing researchers. It fosters quality nursing research, and it teaches the importance of utilizing nursing research in the areas of practice so that we will provide quality healthcare and evidence-based practice.
The project that Oravel and I worked on is the development of an app for patients post-cardiac surgery. It's been wonderful to have the support of Oravel over the last 6 months, helping to move the research forward, but also when she goes back to her clinical area, she will be an ambassador for cardiac rehab. And that's going to really impact and help disseminate the knowledge as well as hopefully impact the quality of care that we provide our patients. So this has been a real huge success for our program. My advice to scientists who are considering this opportunity is to go for it and to pursue this, seize this opportunity. It has been an experience that's exceeded my expectations.
The CAP internship has opened up my eyes to research pursuits, and with that I want to pursue my master's. I definitely love the fact that I already have my foot in the door and have the research training so I can conduct research for UHN in the future.
So I've had the pleasure of participating in the direct entry stream through CAP, and this is a fund that supports experienced clinicians to do their own research. We were funded to develop and test an intervention that would facilitate early symptom interruption in people with bulimia, nervosa, and purging disorder. The pilot project actually did show that we could indeed facilitate rapid response, which was really groundbreaking research. The other impact of this work is that it's really been presented all over the world. So I was able to present it at the Eating Disorder Research Society meeting in Taormina, Sicily. And Danielle was able to take this work to Chicago and present it at the Association for Behavior and Cognitive Therapies, where she won an award for that presentation. And she is scheduled to take it to San Francisco for the Academy of Eating Disorders International Conference. The work that we've done that was funded through CAP has also had a huge impact on patient care. If you could imagine coming to a day hospital, an intensive day hospital treatment, where it really is kind of a altered reality, where meals are supervised, washrooms are locked, you have to stay on the unit. And what we found from this work is that it really does prepare people before coming in. As a clinician scientist, working in the front line at an intensive day hospital, it's very easy to get overwhelmed by my clinical work. And what CAP has allowed me to do is really be motivated to focus on my research and to keep it as a priority. CAP has really allowed me to do what I love and what I'm trained for.